9:30, and we are going to begin our Health and Human Service Committee for Wednesday, June 8th, 2022, and it is 9:30. We will start out with public comment. The first one, is there anybody here that will, yes, come on up.
Yep. Teresa White from Robinson Township. I want to clarify what I was talking about last month at this meeting, that SAMHSA grants, when they come through, have strings attached. So at this meeting that was off campus, must have been the community health meeting, that gender question was also asked at the intake department, and Lynn said that she would follow up to understand the details of the situation. So when it does get followed up, I would like to know if we can have some transparency on what happened there. So going on, but then going into this issue a little further, I come to a provider's introduction to substance abuse treatment for lesbian, gay, bisexual, transgender individuals. This is a 195-page report from the U.S. Department of Health and Human Services. It is on the SAMHSA website. You can download it right from the SAMHSA website. SAMHSA is also written on the report. So on chapter 17 of this report, under managed care, you have continuum of care. This refers to services that are provided in addition to program services and services received after discharge, such as follow-up and monitoring activities, outreach, recruitment, and retention. The types of services offered for LGBT may differ because of their health status of the clients or their partners, their living arrangements, the type of stability of their employment, their level of comfort about their sexual orientation, and their previous experience with service providers and service systems. 3 out of the 14 do's and don'ts on page 99, from what I would think would need to happen here at the Fillmore campus, the jail facilities, and the new Family Justice Center would be, I'm just picking 3 out of the 14. Required training on transgender issues for all of the staff, find out the sexual orientation of all clients, allow transgender clients to use bathrooms and showers based on their gender self-identity and gender role. But you should probably read all 14. Seeing you have grant money already from SAMHSA, and if it was applied for using the LGBTQ+ specifically, we will probably be able to see this in action in Ottawa County, possibly right here in the lobby of Fillmore Complex, and for sure at the jail facility. If I have a little more time, I'd like to address the senior report that's coming up on the agenda today, page 18 and 19. This might also be why senior needs in the county are being addressed in combination with a nonprofit out on the lakeshore, LGBT Connected, because the money coming in for grants using this social.
I'm sorry, Teresa.
That's it?
3 minutes, but thank you.
Yep.
Anybody else? Public comment, first time. I see none, then we're gonna get, do I have approval of the agenda?
So moved. Support.
Thank you. All in favor, say aye.
Aye.
Also approval 2022 Health and Human Service Committee meeting.
So moved. Support.
All in favor, say aye.
Aye.
Same sign for no. I'm gonna double check again. Are there any more commissioners online right now?
We have somebody who dialed in as a phone number, but I'm not sure if it's a commissioner.
Okay, that's fine. Anyway, they know about it. Okay, action items, senior resources annual implementation of the multi-year plans. I guess, do I start with John on this one?
I think Amy is going to be.
Okay.
summarizing. What's that? Oh, we need a motion first.
Oh,
I'll
okay.
make the motion.
Move. All in favor? Oh, discussion first, right?
Yeah.
Yep, that's it. Thank you. So,
Amy online, Amy on Zoom will give us
Okay.
some-
Okay. Amy,
Yes,
you're on.
good morning. Okay. So I'm not sure if you had a chance to review the plan, but every 3 years, area agencies on aging under our state unit on aging provides a planning process. So we went out, Senior Resources went out and did 11 input sessions throughout Muskegon, Oceana, and Ottawa counties. We did an online survey. We did some marketing through out on the lakeshore, I heard earlier, as well as other venues to seek input from older adults, from caregivers, from providers and other interested community members to what services are most valuable and needed throughout Muskegon, Oceana, and Ottawa counties for seniors to remain in their home or in the environment of their choice. A quick kind of review of those results indicated that the #1 concern for older adults is affordable housing. That is the case in all 3 counties, followed by transportation options. While Senior Resources doesn't provide those services directly, we do have advocacy efforts planned within the counties and local organizations to advocate for alternate housing arrangements or alternate housing or zoning rule changes. We also have monies put aside for caregiver support. We know that there is about $8 billion of unpaid informal caregiver support provided throughout the state of Michigan every year by spouses and family members. And we want to be able to support them in the work that they do so they can continue doing it, as well as their strain level reduction while they're doing that work. Meals provision is a huge sort of impetus for the Older Americans Act and Older Michiganians Act funding. And we contract with Age Well Services as well as a few other meal providers to ensure that people who are home limited, who are seeking opportunities to eat with others, have the opportunity to do so. So just kind of a couple highlights of the plan, and I would be happy to answer any questions you might have.
I don't think, John, I got more questions, John. We don't finance a lot of this, do we?
So the funding for the services in the plan come from the Older Americans Act money, Older Michiganians Act money, and
Okay.
then some in-kind funding through the counties in which we serve. So historically, Ottawa County has provided $20,000 of in-kind match per year to leverage about $6 million worth of service that comes into Ottawa County.
And I'm going to go back to some of the previous meetings I've been hearing, even in Health and Human Services and Lansing. I always thought that the biggest issue with senior citizens, and that would be me, but I don't have that, is with transportation, like to and from the doctors. You know, I keep hearing that coming up, if people can't get to the doctor, they miss their appointment. The doctors get frustrated because they don't in there. So is there anything in here to help that too?
So we do address transportation as a gap in services, especially in the eastern side of Ottawa County. You know, some of the more urban, we have the Macatawa, we have the, I can't think of the one in Grand Haven right now. Help me out. Harbor Transit, thank you.
Yeah.
I kept thinking transit, but not harbor. And then Georgetown Seniors in the Jenison area. But there are areas out in Coopersville, Wright Township, along the edge there that really lack transportation. We have some volunteer transportation that we fund through 4 Point Center for Successful Aging that will go out there and do medical appointments, but it still remains a gap in services. The entire amount of money that we're talking about through the Older Americans and Older Michiganians Act, aside from the My Choice Waiver program that provides funding throughout our counties as well, is about $4.5 million. So when we look at that and we look at the services that are mandated for us to cover through the Older Americans Act and what's needed in the community, we're not able to address everything because we could put the entire amount towards transportation, but we do try to ensure that there's at least transportation or a coordination of efforts between us and other organizations to get people to the doctor.
Thank you.
Mhm.
No, just related, I mean, somewhat related to this, transportation's been an issue with our veterans. And we did the last 2 or 3 years, we've received a grant from the state that we've used to provide transportation for Ottawa County veterans to and from doctor's appointments. And with each passing year, that has gotten more and more demand as that's become well known. Now it is limited to veterans, and that goes through our Veterans Affairs Committee, but it does highlight the need for that transportation. Those veterans would be, be considered seniors as well.
Thank you, John. Any other questions for Amy? Thank you, Amy.
Thank you.
I guess we need a vote on this, don't we?
Yep, you had the motion, and then this will go to the Board of Commissioners at the next meeting.
Okay, can you have a voice vote? Think so, right? Okay, so all in favor of passing this senior resource annual implementation and multi-year plans? All in favor, say aye.
Aye.
Same sign for no. Thank you. Passes. Discussion items. Migrant health needs assessment. Amy, you're up.
Okay, wonderful. Thank you.
You bet.
And I had a PowerPoint that I will pull that up.
Oh, we're getting reading material.
Right.
Was want to acknowledge Heather Alberta is here too. She's also been very instrumental in implementation of the survey.
Yeah.
Heather's also been very instrumental in the implementation of the survey as well as the action planning post survey. So just want to say how much I appreciate both of these professionals for the work that they've been doing on this. And you heard a little bit about it in the annual report presentation, but thought it might be nice to take a little bit deeper dive so that you could learn more about it here today.
Amy,
Yeah.
you're on.
Okay. Well, thanks for having me. My name's Amy Shealy, and I'm a health educator with the Ottawa County Department of Public Health. Like Lisa said, I'm here with my colleague Heather, and we've been working on a migrant health needs assessment grant. We received a 3-year grant from the Office of Minority Health. And we, during this past year, conducted a comprehensive needs assessment of the migrant community. The last time this was done was about 20 years ago, so it was long overdue. And we were able to compare some of the data that we received with our general community health needs assessment data, and then really have work on implementation of the strategic plan that we've put together. So I'm just going to walk you through a few minutes of the data that we've collected, and then Heather is going to talk to you just a little bit about some of the initiatives, as well as our partnership with the Department of Strategic Impact. All right, so when we applied for the grant, we knew that this was in good alignment with the strategic plan at the Department of Public Health. So as we submitted our application, we formed a task force of folks in Ottawa County who have been committed to migrant health and were able to come to the table to help us put together this proposal, and then have continued with us after we've collected the data to come up with some strategies to make some changes. Let's see, my clicker is not working. Where should I point it?
There you go. Try now.
Okay. So like I mentioned, with the first year of funding, we were able to survey over 300 migrant farm workers here in Ottawa County alone. And we mostly went to the migrant camps to do that work. They had to be 18 years or older and had to live in Ottawa County in order to participate in our survey. we were able to contract with Dr. Martin Hill, who is the same person who does our community health needs assessment. And he really put together some nice charts for us to help us understand how the migrant population fared in comparison to our general population. So you'll see the green dots are the places where they fared better, the red are where they fared worse. And I should also say that the full report, which is about 200 pages, is available online at healthyottawa.org. So you can really, if there's a specific area or something that you're particularly interested in. You'll see on this screen where the migrant population fared a lot worse was not having healthcare coverage, not having a healthcare provider, not having access to healthcare. So that was definitely an area we knew we needed to tackle. Also, difficulty understanding written and verbal information because many of them were Spanish speaking only. So we saw some migrant health where they fared better. You'll see on this screen with smoking, drinking, and in one case, a little bit more fruit and vegetables than our general Ottawa County population. Where we also saw a huge health disparity, which didn't surprise any of us, was the preventative screenings. So you'll see red dots on this whole sheet, just really making sure that folks have access to healthcare and prevention services. We know is just a huge area of need for our migrant population. And then this screen is a little bit interesting because it shows them faring better, but we know that is a result of them probably not going to the doctor in the first place to be diagnosed with some of these chronic conditions. So then in the report, after we were able to compare the data with our general population, Dr. Hill was able to dive in a little bit deeper to help us get an understanding of some of the responses that they had. So I just pulled a couple slides to share with you guys today. And again, just encourage you to check out our report online for full details. But this is one about healthcare coverage. We see almost 70% do not have healthcare coverage. And then some of the reasons that they listed.
One little question.
Yeah.
You said this hasn't been done for
20, yeah.
Okay.
Mhm.
And you said you interviewed close to 300,
Yep.
right? Do you know 20 years ago how many? You weren't here, but
I was.
okay.
Did you?
It was just over 200, our
What?
data, Marcia.
Yeah, I was gonna say it was less. I know.
Yeah,
Oh, it
it
was
was.
less.
Mhm.
Okay, I'm asking because there were less here, or you just took that number and stopped at that number, right?
I would say that we had some process challenges. At that time, the survey was constructed a little bit differently. It was more, we went out and we had to meet with people face.
It was one.
Very limited staff
Okay.
time. I mean, at that time it was 14, we're traipsing out to places all over the county just to try to gather information from people. So it was a little bit more cumbersome.
It was, yeah. I would say this year we had the benefit of we were able to use some tablets, and the survey was in both English and Spanish, and folks who felt comfortable using a tablet and felt comfortable reading were able to do it on their own. For folks who weren't comfortable taking it because of literacy or whatever reasons, we were able to do a survey in Spanish verbally with them. But that really allowed us to sort of speed up that process. So that's a great question.
Okay, thank you.
Was in the survey, did you look at like H2A workers versus?
Yeah, that's a great question. So in a couple slides, I'll show you a demographic snapshot of the migrant farm workers. And absolutely, we did get some H2A. And actually, Dr. Hill did break it out when possible. So for some of the responses, we were curious about that exact same thing. Who does H2A status change the health status or change some of the needs? So we looked at that a little bit when we could. That's a great question. All right.
Sorry to interrupt.
No, thank you. Please jump in whenever, for sure. So health literacy, just again, I touched on this earlier, but the difficulty understanding written information when not in Spanish. So I think this was a big takeaway for us and our coalition members as we work to address some of the needs in the migrant community, was just making sure that that we can remove that language barrier. Weight status, we found obese and overweight was a big problem in the migrant community. We found that primarily the case in women, but was something for us to continue to work on. Problems receiving healthcare. So about 30% had difficulty receiving healthcare. And then this is kind of a list of some of their responses. Transportation, I noticed, came up in your previous conversation with seniors. And I would say, again, of course, is one of the issues we struggle with the migrant community. So Heather will share with you a couple of the strategies we have for working to address the transportation issue. But I think that's a really big issue for our community. Fruit and vegetable consumption. We've been able to partner with Ottawa Food for some neat initiatives that Heather will talk about as well, but continues to be a problem both with the migrant community and the general population. Food pantry usage. When you received that little booklet, we one of the things we've been working on is making sure folks know what resources exist in our community. That seems to be something that we all struggle with across the board, making sure folks know what services exist and how to access them. So this was our attempt to get everything in one place so that they knew what services exist. And food pantry usage, we realized one of those top answers was they didn't even know it existed. So how can we just do a better job making sure that our food resources are available to our migrant community? Healthcare provider, this one wasn't surprising to us, but good for us to have the data about the need for personal health care providers. We've been partnering with InterCare and some of our free health service providers, Holland Free Clinic, Love in Action, to really make sure we're trying to address those needs. Oral health was another really big one that was a huge disparity from our general population to the migrant, is that their oral care we really needed to address that. Another thing that really stood out to us, and emotional support, really asking people, how many people do you have in your life that you could really call on for help when you need it, practical help, like maybe helping with groceries. And this number was dramatically less for our migrant population than it was for our general population. So again, we're working on some initiatives to really build that sense of community and that sense of social support. And I just thought this was good to share as well. We partnered with the United Way and included these questions that are part of their inclusion questions that they like to ask, and really just kind of getting an understanding of how do folks perceive Ottawa County. And we found 77% believe Ottawa County is inclusive and welcoming of all people. So that was a good thing. This is the slide I mentioned about the demographic breakdown. So H2A is on there. Oh, shucks, is it not on that one? Oh boy, I'll have to get back to you on that. I have 2 slides with farm worker demographic, and we had H2A on it, but I'm guessing I chopped it in the interest of time. But I will get back to you on that because I think that's an important question. So I'm going to turn it over to Heather. After we had all of the data, we took it and worked with the Department of Strategic Impact, and they led us through a strategic planning process with our coalition and really helped us to understand what is it we can do with this data? What is a reasonable 2-year strategic plan for us to put together? So we were so appreciative of their partnership and leadership to help us move it to the next level. So I'm going to turn it over to Heather.
Yes, so we were able to pull in Shannon and her group from Planning and Performance, and they came to work with our larger migrant health task force and kind of looking at what do we do with all this data? What are some of the things that we are going to be able to tackle in the next 2 years? How do we want to put our strategic plan together? What are going to be those measurable goals and objectives that we're going to be able to report back to our grant funders? And so they were really instrumental in kind of helping us to break down that data and kind of prioritize what we would like to work on, and also be thinking in as we move forward, what is the sustainability going to look like once this grant comes to an end in 2 years. Ooh. So one of the things that we decided to put together in regards to the data that we saw based on feeling included, welcoming the workers into our community is welcome baskets. And so we reached out to our local growers here in Ottawa County and let them know kind of what was going on, what we were thinking about, and that we were thinking about putting together laundry baskets that came with paper towels, frying pans, cutting boards, knives. We had food donated from Ottawa Food in the Community Action House. So non-perishable foods like rice and beans and cooking oil. Did shampoo, we did bar soap, we did hand sanitizer, wipes, cleaning products for their homes. And we were able to disperse 300 of those baskets to our growers to provide for their workers, some of them who have arrived already and some who will be coming in July. And so just to give you an example, First Pick, which is out in West Olive, they plan to have over 1,000 workers this year in the blueberry field. Manzana, we went up to in Conklin. He'll have about close to 2,100 H2A workers working for him. And so just within those 2 camps, it's over 3,000 workers that are coming into our community to work. And inside those welcome baskets, we included information. We included the resource guide that you see in front of you, along with information about upcoming events like LAUP is hosting the Fiesta in July at the Civic Center. So inviting them to other community events that will be happening as well. One of the other things that we also put together to increase community connectiveness as well as break down barriers to transportation is that between where Harbor Transit stops and where the Max Bus stops, there's this gap kind of in the West Olive Grand Haven area. And so again, we're working with First Pick and another grower out there. Because again, a majority of them are H2A workers. And when you're an H2A worker, you arrive with no transportation. So you depend on the grower or other people to bring you to get groceries or go to church. And so we are collaborating with St. John's Episcopal Church in Grand Haven, the Momentum Center, as well as Watermark Church to offer transportation every Sunday, starting the last Sunday of June, running through the end of August, that we'll be able to bus them to St. John's for Mass, for church. They can stay there for a lunch. We'll bring them to Walmart to get groceries. And then they also have the opportunity to go to Watermark to use their laundry hub. And all of it will be free of charge to pay for the groceries when they go to Walmart. But all the rest of that will be free. So picking them up, dropping them off, they can pick and choose what they would like to do. If they would really just go to Walmart and do their laundry, we're totally fine with that. So again, working to provide that transportation from those sites and back to the camp again. So we're really looking forward to that. Another great piece of that is that we're also including individuals from our Migrant Health Task Force to be greeters, right? To be helping at the laundry hub, to be at the church. So again, they're just feeling that sense of connectivity within their community. Because even though they do live in large groups and live at camps, many of them come maybe be the only person from their family who has arrived here in the US. And so they don't know anyone, right? And so again, just trying to build that connectiveness that we see that's much needed for that social circle. So we are super excited about that initiative. We did our last welcome basket drop off at Verhaeg Farms in Hudsonville. They did 100 baskets and they were just provide. They kept it on the down low. They wanted to surprise their workers when they got there with all the things that had been delivered. So we are excited. So here's our Together in Grand Haven flyer that we put together. Thank you for putting that in there, Amy. One of the other needs that we chose to focus on was also access to dental care. So collaborating with InnerCare, with Miles of Smiles, with the Holland Free Health Clinic, along with Love in Action in Grand Haven, we were able to, we're going to be piloting dental services in 3 specific camps. So be able to provide dental care more than just once, because typically if you haven't had your teeth cleaned in 5 years, it takes more than one 30-minute appointment to get your teeth cleaned. multiple times to help address. We're going to also tried to be strategic about where we were doing it. So we're doing it up in Conklin, right, with Gavin Farms here at Bowerman, and then with our ag installers, which is in Holland as well. So kind of making sure that we're getting all parts of the county, touching all of those quadrants.
Quick question for you, Heather. Are you going to be doing that during the day or evenings?
Yep. So with each grower, we asked specifically what worked best for them. Some growers prefer after the workday, and another grower is okay with us coming during the day and pulling their workers from the fields and for them to be able to access dental care during the day as well.
Because one of the things to keep in mind is if they're not in the field, they're not making money.
Yep. And so that's why we worked real close with the grower to pick that. I mean, there's no ideal time, right, to go to the doctor or the dentist, right? We all have to do that. But we wanted to make sure that we didn't, when things need to be picked, they need to be picked, right? When the weather's good, they need to be out there. And so with every grower, it was a little bit different. So we just made sure that we had that good connection and coordinate that with the grower before we went out there. Oops. I think, is that it, Amy?
Just the Boys and Girls.
Oh, and the Boys and Girls Club, yep. And then one of our other initiatives is actually in collaboration with Community Action Agency. So this year, we are able to actually expand. So West Ottawa schools, as well as Grand Haven schools, provide a summer migrant program. The West Ottawa kiddos are able to be bused to the Boys and Girls Club after school for extra programming, for activities, all sorts of, again, fun things in regards to being connected. And so this year we partnered, we reached out to Community Action Agency, and they were able to write a grant that's going to provide additional funding so that we can bus the kiddos from Grand Haven Summer Migrant School to the Boys and Girls Club as well. And so they'll be able to, again, participate in activities, have meals sent home with them. And again, just be able to, again, create more connectivity with our kiddos before the end of the day. One other initiative that I didn't mention, because is that we're also collaborating with Spectrum and again with the Community Action House to go and provide fresh fruits and vegetables to certain vans. So we're going to be bringing out our veggie van and driving it to certain camps and being able to hand out fresh fruits and vegetables. And also in collaboration with Community Action Agency, they'll be a part of the commodities giveaway. So we'll be able to provide those boxes of foods to our farm workers as well that participate in that veggie van initiative. And I think with all of that, yes.
Joe, you bring up a really good point. I want to emphasize that, obviously we're really trying to help work sense of belonging in the community. These workers give a tremendous amount of themselves to the economy of Ottawa County. They're valuable members of our community for the time that they're here, and we're really working hard to wrap around. We also know that healthy workers are productive workers. And so one of the other things that we did a lot of over the last 2 years and continue to do this year is getting out there and talking about COVID prevention. We're doing COVID vaccine clinics. I don't know if you want.
One of the other events that'll happen at the end of July is going to be, again, in collaboration with St. John's Episcopal Church in Grand Haven, but they're going to be hosting Fiesta en el Campo, and we'll be going in and be having vaccine clinics. There'll be information tables. They're going to have food trucks. And again, just creating a sense of community within those camps that are there. And we're also going to be collaborating with InterCare throughout the summer to be providing COVID vaccines when we go and do outreach pretty much on a weekly basis. And so we've been able to be better collaborators this year and have a community calendar. So we each know when each other is going out and when we can help participate or help kind of go along and be able to give out information. So we're working closely with InterCare as well within those communities to provide health services along with COVID-19 vaccines. And we've gone to some of the camps already because many of the workers like at Spring Meadows, for example, have arrived. And so we've done 2 vaccine clinics already for them. Vaccines, and usually we do about 100 every time we go there. So
Just to be clear, the This is not forced, it's all volunteer.
Mhm.
We actually respect everybody's decision about whether or not to vaccinate. We're there to provide information and answer questions, and we've had people come to us that just want to talk because they're confused with all of the
they may have
information
gotten
out there, so we
they may have
take the
gotten-
time to
Yeah,
to do that
vaccinated
as
in
well.
Mexico, and now they're not quite clear what maybe vaccine they need now because vaccine there and what in terms of what's the next step. And so it's been just great connecting with our growers, and I think building that that piece of collaboration that maybe wasn't there previously. Thank you. Sorry.
Okay, the people that are talking to the migrants, are they any of them fluent in Spanish?
Yes, so when we did the assessments, we hired individuals, they were contracted, who will probably, like Abby, for example, who works in the migrant summer program,
Okay.
along with myself, we had other staff that was available to go out and to assist with that. So yes, we always make sure that we have translators or staff that are bilingual when we're going out to the camps.
Sounds like these programs, the growers really support these type of programs. Are most of these programs, whether it's providing the welcoming basket or the transportation or the trips to Walmart, for example, are these mostly grant funded?
Yeah, so all of the funding that we've been receiving for last year, this fiscal year and next year is all totally grant monies that we're using for the initiatives.
Okay.
Yep.
Great, thanks.
Yep.
Good program. I hate to see it lose steam or anything that involves with it. So I think it's important. Thank you for your comments.
welcome.
Any other questions? Jim, got any? No. Oh, okay. Okay. Thank you. Next is departments. Jennifer, we're going to start with you today.
So as we were just talking about, our migrant program is obviously looking different this year. Instead of handing out gift cards, it's partnership to help with transportation for Grand Haven area kiddos at the migrant farm worker camps. In addition, I know I mentioned this last time, but we are still working hard to provide outreach for seniors in the Ottawa County area for food. Our senior food program has lost some funding, and we want to make sure that we are getting the word out to as many seniors as we can. We've started doing outreach to different senior sites. We started with Wildwood Creek Manor last week, and we're going to keep expanding and try to reach out to as many seniors as possible. Not a whole lot else. One big update for us is that we are anticipating a large amount of money coming for our weatherization program from the Department of Energy. Right now, they're estimating that Ottawa County next 5 years. So that would double, if not triple, the production in that program. So most likely we are going to need to onboard more staff members, probably intake staff, and we'll probably also need to hire a weatherization inspector. So that could be coming in the next couple of months. And
Jennifer, are we having
yeah.
issues getting contractors for that type of?
Mentioned that was also in my notes. So something that's really important for that program is that we have weatherization contractors. That's been a huge gap for us. Right now we have 2 contractors. We really need to have 4, 5, maybe even 6 contractors. That's been a huge challenge. We've put out an RFP and got one new one to add it from 1 to 2. And we're hoping to keep that open throughout the year. So if you happen to know any contractors that really want to make a difference in energy usage and costs for low-income families, please let us know. We're working closely with purchasing to try to find more contractors because we can hire staff, but if we don't have the contractors to do the work, then the program's not successful. That is definitely something we're working hard at. That's all I have.
Any questions, Jennifer? Thank you. Lynn?
Good morning. Do a couple of things.
Lynn, do you want to just put your microphone closer to you?
Sure. Is that better?
too?
So at CMH, we continue to be very busy. I've mentioned that the last several months, our requests for children are outweighing our requests for adults at this time. That's been the case for a couple months, but that's actually pretty new to us if you look at past years. So we are doing our best to address that increase in demand. However, staffing continues to be a pretty big issue for us. Internally, we still have positions that are vacant and have been so for a while. But really a bigger problem continues to be with our contracted providers, especially those who are doing direct care service. Our providers continue to struggle to attract workers and retain workers. That isn't necessarily an issue for us. It's throughout the state and the country. However, there are a couple of things that make Ottawa County kind of unique in attracting direct care work staff. And it has to do with the employment situation right now. Lots of jobs are out there. Even though we have paid close attention to our contract providers and provided increases in Medicaid rates as well as assistance through our millage program, they're finding it difficult to keep up with other businesses. Housing also plays a big part in staffing. As we all know, affordable housing in Ottawa is scarce. So a lot of those direct care workers that they are able to hire actually live in our surrounding counties. And then add to that the current situation with gas. So it adds up to sort of the perfect storm for us here in Ottawa County as far as being able to attract those direct care workers. We continue to work very closely with our providers. I usually schedule a monthly meeting with our larger and just to take the pulse on how they're doing. All of that, it not only impacts the current direct care worker situation. Those direct care workers work in our group homes. They also work as community living support staff that take people out into the community. But that lack of has directly contributed to the problem we're having with housing and residential placements. We have repeatedly asked our providers to open up new beds, but they're telling us they simply can't do it because of the staffing issue. So we are continuing to work on that issue. We don't sit still and say, well, it's a problem and we're not doing anything about it. We have a parent work group who's been meeting to explore affordable and accessible housing and maybe looking at future development. And we also have had another group that's looking at supporting individuals in residential settings using tech. So that doesn't work for everybody, but other counties and CMHs have done more work with using, it's almost like a two-way call system. There's a phone in a person's apartment, and that's connected to a phone bank. So if someone needs help, they can simply call out and say, hey, I locked myself out of the house or whatever it is. And there's staff there that could respond to them. So we're exploring that as well. Some other news, the people on our board know this, but we are losing our current finance manager. Keith Falkowski's last day is Friday, which is bad news for us. He's been but I'm happy to announce that Amy Botbaum-Mast, who is currently with our finances, county finance and fiscal services, has decided to take that job. And we're excited that she's going to join us. There's a,
I'm happy for you.
thank you. There's,
But are we stealing from Peter to pay Paul?
We are.
well,
Yeah, Amy's our purchasing manager, so now we'll have to replace our purchasing manager.
So,
But they stole Keith from us. So we
okay.
we just keep
Now,
recycling.
okay,
Sorry.
and I don't want to interrupt you, Lynn, but are you both experiencing worker shortage?
We have challenges finding nurses.
And you got healthcare workers, I mean,
yeah, that, and we've also had difficulty in some places attracting master's level clinicians.
okay.
And again, that is across the state, everyone we talk to. And,
Because you're limited on how much you can pay. Because the private sector,
yes,
they can up it,
that definitely has.
and they can pass that money back. You guys can't. Okay. Jennifer, do you struggle with finding workers?
We did have a challenge when we had an opening. We're very small, so we're,
Okay,
the last time we had an opening, it was open for several months.
I can also add, it's not a problem with finding people, but we're very challenged with some of the people that we have. We've got really heavy burnout,
oh,
lot of trauma that we're
Mhm.
trying to work through.
yeah,
and-
understand that.
And even, you know, the current climate right now, I don't think I need to describe what that climate looks like. It sort of has a dehumanizing impact on people that are really trying to do a great job.
Yep.
And this week I also participated in a healthcare workers from one of our large health systems. And, you know, it's the same for the healthcare workers in the hospital and other settings. It's really tragic because
Yeah, understand. Oh, thank you, Lynn.
Yeah, you're welcome.
Were you done? Okay.
No, I'm good.
Okay. Lisa?
couple quick things. I mentioned at a previous meeting about the after action reporting that we're doing. It's a very, very comprehensive process. We've broken into teams and we've evaluated all the different phases of our pandemic response, all in an effort to improve when we have events like this. I really hope and pray that we never have an event to this scale again, at least in my lifetime. But we can learn many lessons and apply those things that we've learned to do continuous quality improvement in how we respond in and outside of a crisis. So one of the, as we did send out a survey. I'm not going to go into all the details today, but just to say that we have concluded that we had almost 50% return rate, which is really huge. It was sent about 500 of our partners who were very, very instrumental and helpful throughout the pandemic, whether it was a school person or a business person or a person in a nonprofit agency who was really addressing many of the needs that our community members had throughout the pandemic. These were the people that responded. It was, John had a great question when I talked to this. Did you just send it out to all of your friends and family members? No. We sent it out to anybody who we had a touch point with in a partner role had the opportunity to fill this out. I'm happy to report just one important statistic. We asked people to rate on a Likert scale of met or exceeded expectations all the way down to didn't meet expectations. And in each of the categories, over 90% of the people responded that we met or exceeded the expectations. Now, having said that, there's always room for improvement, and people provided some great feedback, and I'll get into more of that hopefully at a future date. Because again, we're committed to quality improvement. So the vaccine for the COVID vaccine is very close to being available for 0 to 5. And so we are sort of gearing up. We We're hoping to push many of those folks to their primary care provider for that. We won't be doing mass clinics like we've done in the past. We may be having some clinics at the health department or at sort of strategic community locations, but we do feel that for those that have availability in a primary care office, that's the best place for them to go so they can consult with their physician and ask those questions and so on.
And that would be on a voluntary basis?
Oh, absolutely. Yes. This is not a requirement. Again, a requirement for vaccine is not my decision. That is a state and federal decision, mostly state. In the state of Michigan, all vaccines are voluntary. So there is the ability, if you are a parent who does not want to vaccinate your child, to get a waiver. We've been doing these waivers for years. They do come in and talk to us just to get an opportunity to ask questions, but it's their choice. I want to just mention, this information just came to us yesterday that we did have a child COVID death. I know that this was something we hoped never would happen. This occurred in January, but with all childhood deaths, they have to go through the medical examiner's office. This death actually occurred in a hospital outside of our county. It went to a medical examiner in Kalamazoo because that's who they subcontract. So it takes some time. And we were just notified and received the death certificate yesterday. So it was a child under the age of 2. It's also reviewed by the CDC, so
Yes.
that's delayed
Okay.
this a little further.
Okay, I get, just finding out. So they were a Ottawa County citizen?
Yep.
Okay. And because of where the child died is because it ended up in Kalamazoo? Okay.
Well,
So
yes,
like if
because-
they were in.
So we have
visiting
Dr.
in-
Start, who's our medical examiner.
Yeah,
And so if we used him, that decedent would go to Kent County to
Okay.
Dr. Start or Dr. Cole.
okay.
This county was Muskegon County,
Oh,
and their
okay.
medical examiner is in Kalamazoo.
Okay.
They go through
Yeah.
Western Michigan University's
Okay.
medical
Yeah.
examiner
Thank you.
program. So
Thank you.
yeah, it's different in
Well,
every county.
When I go to Lansing for Health and Human Services, this medical examiner stuff is talked about all the time. They all would like some help from the legislators. It's saying, let's try to get some uniformity of where in there. Counties struggle where to go. So thank you, Lisa. That helps explain where this is all going. Okay.
That's all I have for today, unless anybody has any questions.
I don't. Okay, Patrick, you're up.
Alrighty, thank you. Well, let me start by just thanking you for your grace and allowing me to participate virtually today. I fully intended to be there, but speaking of COVID, I'm dealing with some coughing flare-ups this week. I'm full month past COVID, but it's a weird virus. So thanks for letting me join virtually. 2 things I wanted to highlight. One is something I mentioned briefly last time. We are helping to facilitate some dialogue in Ottawa County related to the increasing numbers related to our unsheltered homeless population. So just to give you an example, Community Action House has an outreach team that is out in certain homeless camps and in other spaces and developing relationships and really tracking our unsheltered homeless population much better than we ever did. 3-4 years ago, we actually never had an outreach team like this. And to give you just a sense of numbers, we've seen about a doubling in terms of the number of unsheltered from the first quarter of 2022 over 2021. And a lot of the community is seeing this. Local municipalities are being asked about it. Providers, nonprofit providers, government providers are noticing this. And so we're trying to get our hands around that and just, collaboratively, as we do in Ottawa County, look at what might be some potential strategies and solutions to address that. And so Two populations in the unsheltered homeless that we're going to really focus on. No surprise to Lynn, one of these is those with mental illness and severe mental health. And we can actually show that a large percentage of these folks that are unsheltered do present with a mental health disorder or self-identify as having a mental health disorder. And then the other population is victims of domestic violence. And I think I mentioned it last month, but we have a phenomenal provider in our community in Resilience who provides the domestic violence shelter, but they simply don't have enough. And Lynn brought up affordable housing, and that's one of the primary drivers here as well. But we also just don't have enough providers that are equipped to handle some of the severe cases that we're seeing. And so we've only had a couple meetings, so we're very much on the front end, but hopeful that we can come up with some strategies and solutions here over the next year to address this growing need. And I should also say this is not unique to Ottawa County. We're certainly seeing this across the state and across the country. The other thing I just wanted to highlight on, and I also believe I mentioned this maybe last month, is I hope we're kind of trying to get ahead of the curve here, but as you all know, we saw quite a substantial increase in federal and state funding to address just COVID-related impacts in our community. And a lot of that funding is going to start, I'll call it normalizing over the next couple of months, going back to kind of pre-COVID, levels. And we're trying to get ahead in terms of what does that actually mean for our community, and informing some of the folks, some of the organizations, the providers, nonprofit, government that will be having to deal with some of that normalizing. So, for example, I was just emailing with Lynn and Kendra, who are both here today this week, but the increase in Medicaid recipients over the last 2 years, and Kendra's talked about this before, that there hasn't been verification for that, and there will start to be. So we anticipate some folks that have had Medicaid that will go off it. That's going to impact Lynn's funding, but also what does that impact mean for those individuals and families, and trying to better understand that. There's been increases in food benefits, as Kendra has talked about. That funding will start to normalize. Families won't have that increased benefit. We'll also see free school lunches. There will be qualifications for that again, where there haven't been over the last couple of years. So again, the goal with all of this is to, take food, for example. If families have been relying on an increased benefits and school lunches, and that goes away, what does that mean for their budgets? Are we going to see an uptick in programs like Food Club and food pantries and other places? And can we get ahead of it a little bit and let those organizations know, hey, you might need to ramp up in preparation for this? Another big one is the eviction diversion program. Over $15 million has been spent in the last 2 years to keep folks in their homes. What is that? Speaking of the unsheltered population, I can only imagine how much worse that would have been had we not had programs like eviction diversion. But just trying to get ahead of that and prepare our community for some of those benefits rolling off. So that's it for me.
Any questions for Patrick?
Nope.
Okay, thank you, Patrick. Kendra, you're up.
Good morning. So Patrick kind of did a lot of my updates, which is great. That means information is definitely getting out. So the June allotment for extended food benefits did occur again. That we were just notified actually 2 days ago. So individuals will receive the maximum benefit or minimum benefit of $95 continuing. Again, that's something we receive information on a monthly basis. So we don't have an end date at this point as far as when that will end. No updates on the public health emergency at this point. We were originally slotted for July. However, July is only a few more weeks away. So I believe that will be extended most likely to September. And then lastly, as kind of already talked about, we are definitely in the beginning of migrant season. And so our 5 staff have been actively out in the community at events, working with the farmers and the growers. to get as many individuals as possible on emergency medical for those that qualify. So definitely a lot of efforts there. Actually spoke with one of my migrant staff the other day and just discussed some of the importance, not only of the work, but also my staff are all bilingual, 2 of which actually were migrants themselves. So really have great relationships out in the community with those farmers and the migrants. And we also this year included a male on our team, which we have found to be fantastic. That's definitely been helpful for some of the relationships, as in the past, we've had a team of 5 ladies, which are great and they work very fantastic together, but it really has helped with the relationship as most of the migrants that we work with, a majority of them are males. And so definitely finding some of those tweaks that are very helpful for us to engage in the community. So at this point, those are my biggest updates. On the child welfare side, we are starting to see an increase in our cases. We're seeing more severity in relation to what is being called in and reported for CPS. We still are actively involved with preventative efforts. And so continuing to do that through our CPS redesign to attempt to go out to families before they're actually coming to us with an assigned CPS referral. So definitely very busy. We are definitely back to pre-pandemic levels in all areas. And that in regards to our child welfare side. So we're very busy. I don't know if you have any questions.
Thank you, Kendra. Any questions, Kendra? No, thank you. Before we go on, I think I interrupted Lynn before she was done. So Lynn, do you have, I think you had one more point you wanted to make, so I'm going to go back to you and at least let you finish your.
Thank you. Well, I did have just one more thing on there, and I've talked to this group before about some legislature that's proposed right now. Bills 597 and
Yep.
598
Yep.
Are in the Senate right now. We're hearing that Senator Shirkey may try to push those out of the Senate in the next couple weeks. And if you'll recall, those bills in essence take the funding that is currently assigned to the CMHs and the PIHPs and moves it to the Medicaid health plans, many of which are for-profit large organizations. My concerns with those proposals are that I believe there would be a loss of local control and governance and input. I'm concerned about for-profit companies managing our system, and there isn't enough money right now. So to skim off money, it worries me that would impact client care. The proposals state that they are trying to improve integrated care, meaning the relationship between physical health care and behavioral health care. And I'm just not convinced that those proposals would actually do what they propose to do. So if you're inclined, talking to our local legislators now about those bills, asking questions is probably a good thing to do. So if you need more information on any of that, please don't hesitate to give me a call. We also have information on our webpage.
Thank you. Got the emails yesterday. So. Thank you.
Yes.
Okay. Okay, done with the departments. Second public comment for the day. Is there anybody in the audience that would like to give a public comment?
Can I ask a question?
Yes, you may. Come on up to the podium. I'm not saying we're going to give you an answer today, but you gladly can ask questions.
Okay, I'm Betty Bestman from Jamestown Township. I don't hear a whole lot of mention of our side of the county, so sometimes I wonder if we actually belong in the county, but that's a different thing.
You're the one of the fastest growing townships.
Yes, we are. Yes, we are. I know we are. My question is, we've talked a whole lot about grant monies. There's grant monies for these different programs, and not against that, but my question is, what happens when those grant monies? There was one that was talked about it's a 2-year grant. So in 2 years from now, what happens to that program when that grant money runs out? That is my question. Is that then? Or does it continue with Ottawa County funds?
General fund. You know, I'm thinking, John, do you want to kind of answer a question like that? You got other departments that have grants.
I mean, it's
too,
have
right?
grant money. I mean, I've been to Ottawa County Commission meetings. There's a lot of grant money out there. My husband worked for the city of Hudsonville. There's a lot of grant money that works. And our question has always been, eventually that grant money runs out because it's only a grant for a period of time. Then who picks up the funding after that? Is that the township? Is it the county taxpayers? If it's a taxpayer thing, then you may need to look at, is it really benefiting all the taxpayers? Thanks.
I can just speak to the migrant grant. You know, that is a one-time grant, and you're right, its duration is for 2 years. It's specifically for doing an assessment and identifying a strategic plan, and we're able to carry out some of the strategies in that plan, but then it will be over. To a large extent, what we see with other grants like this one is community partner stakeholders who have a special interest in, helping migrant farm workers belong and feel or have access to healthcare, and all those things will pick up pieces of that and continue it. We're always very, very cognizant of the temporary nature of grant funding. Some grants we don't even go for because we're not sure about how we could sustain the objectives. But yeah, we're always looking at that. Very, very rarely does the county pick up and fund these grants after they run out with general fund, unless it goes through a huge giant process and it's a need that the taxpayers have been able to vet.
Well, you never say, well, the county would never, ever
Yeah,
pick
no,
something
no.
up. The expectation for any grants that we apply that have a finite period of time is that, there's definitely no guarantee that the county is going to pick up those expenses once that grant expires. And usually the expectation is you're going to have to find funding from somewhere else. And so we have, programs, we have, staff positions among various departments that are funded by grants. And if those grants go away, then, there's a likelihood that those programs and maybe even staff goes away unless we can find alternative funding. And with anything else, we evaluate our priorities as a county with both general fund taxpayer money, grant fund, Medicaid revenue, and we decide, what's the county as a whole in terms of how we spend that. But the general expectation is when the grant goes away, you need to find additional funding from outside the county for that.
I hope.
Yes.
Okay,
Somebody's
thank
gonna
you.
pick it up.
Okay. So move. All in favor, say yes. Yes. Thank you.